Hello, listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. I'm your host, Anna, and as always, I'm joined by the brilliant Dr. Kota Reddy.
It's a pleasure to be back, Anna. Always excited to delve into these important health topics with you.
Me too, Dr. Reddy. Today, we're diving deep into the world of heart health with a condition, that might sound a bit unfamiliar. It's called aortic sclerosis.
Absolutely. Aortic sclerosis is a fascinating condition and one that's really important to understand, especially as we age. It's all about changes in the aortic valve, the heart valve that controls blood flow from the heart to the rest of the body.
But before we dive in, I'd like to remind our wonderful listeners, if they haven't yet, to take a moment to hit pause and subscribe to the podcast. By subscribing, you'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story at a time. So, Dr. Reddy, what exactly is aortic sclerosis? Like, what happens in the heart?
Well, in aortic sclerosis, the aortic valve, it becomes thickened and stiff, often due to calcium buildup. Now, it's important to understand this thickening doesn't necessarily obstruct blood flow initially, like in aortic stenosis, but it's definitely not a benign finding. It's often a sign of underlying, cardiovascular issues.
Oh, wow. Okay. So how common is this aortic sclerosis? Like, how many people are affected?
It's pretty prevalent, especially as we get older. Studies show it affects about 21 to 29% of adults over 65. And that number jumps to about 37% in those over 75, right? So, it's something to be aware of.
Wow, that's quite a lot of people. And you mentioned it's not benign. Like, what makes it so significant then?
Well, aortic sclerosis is a strong marker, a really, really strong marker for coronary artery disease. And it's linked to a 50% increased risk of death from cardiovascular causes, including heart attacks. It's definitely something we need to take seriously. So, let's dive into the causes and risk factors. First off, age-related degenerative changes. As we age, our tissues can, they can wear down, and the aortic valve is no exception. Then there are atherosclerotic processes, like the buildup of plaque in the arteries, very similar to what happens in coronary artery disease, and genetic predispositions also play a role. Some people are just genetically more prone to developing this condition.
So it's kind of like a combination of factors then, like getting older and maybe your genes and also this plaque buildup?
Yes, exactly. And then you have specific risk factors that increase your chances, like age itself is a major one. As I mentioned, it's more common in older adults. Men are also at higher risk, and smokers, hypertension, high cholesterol, especially LDL and lipoprotein A, and diabetes also significantly increase the risk. So it's a mix of things that contribute to it.
Okay, so if someone has aortic sclerosis, what kind of symptoms would they experience, and how is it actually diagnosed?
Right, so the tricky thing is, aortic sclerosis can often be asymptomatic, especially in the early stages. But as it progresses, common symptoms can include dyspnea, that's shortness of breath, angina, which is chest pain, heart failure, and even syncope or fainting. These symptoms aren't always directly caused by the valve thickening itself, but by the underlying cardiovascular changes that often accompany it.
Oh, wow. So you might not even know you have it?
Exactly. That's why early diagnosis is so crucial, right? And the best way to diagnose aortic sclerosis is through an echocardiogram. It's a really simple and painless test that uses sound waves to create images of your heart. This allows doctors to, visualize the aortic valve, see how well it's functioning, and assess the extent of any calcification or thickening. Speaking of lifestyle changes, I've got a couple of patient stories that really highlight how powerful they can be. I had one patient with a significant calcium buildup, early signs of aortic stenosis, the whole 9 yards. This guy, he just totally overhauled his diet and started exercising regularly. He ended up losing 60 pounds. And get this, almost 14 years later, his calcification hasn't progressed at all. It's totally amazing. It just stopped in its tracks.
Wow, that's incredible. 60 pounds, that's like a whole person. So just changing your lifestyle can actually halt the progression.
Absolutely. It can really make a world of difference. Now, I've got another patient whose aortic valve area decreased to about 1.1 square centimeters. Now, a normal valve area is about 2 square centimeters, and anything below 1 is usually considered like critical, right? So I told him, look, you need to make some serious lifestyle changes. And he did. He really took it to heart. We monitored his condition every 6 months, and for 2 years, his valve area stayed stable at 1.1. Pretty impressive, right?
Yeah, totally. So like he avoided needing surgery just by changing his lifestyle?
For a while, yeah. Unfortunately, his valve area did eventually decrease to 0.9. So I referred him to a medical center for a valve replacement evaluation, right? But it's been 4 years since he made those initial lifestyle changes, and he's still holding steady at 0.9. They keep evaluating him and saying he's not quite ready for surgery yet.
That's pretty amazing. So even if it progresses, making those changes can still buy you time.
Exactly. These stories really illustrate that, well, no matter what stage you're at, making healthy lifestyle changes can have a huge impact. It can slow or even halt the progression and potentially delay the need for more invasive procedures. It's really, really powerful stuff.
Dr. Reddy, what are the consequences if, you don't address this condition?
Well, several serious complications can arise. One of the biggest is increased cardiovascular mortality and morbidity. Individuals with aortic sclerosis have, a significantly higher risk of death from heart-related causes, like about 50% higher compared to folks with normal aortic valves. This includes an increased risk of things like heart attacks and other cardiovascular events.
Oh, wow, 50%. That's a lot.
It is. It's a serious issue. And another complication is the progression to aortic stenosis. Aortic sclerosis can, develop into aortic stenosis, which is a more severe narrowing of the aortic valve. This happens in about, 1.8 to 1.9% of patients with aortic sclerosis every year. And severe aortic stenosis, well, it can be life-threatening if it's not treated. The 4-year untreated mortality rate is around 45%. So, it's important to catch it early.
That's really scary. So it can actually become a much bigger problem if left alone?
Yes. And then there's heart failure. Untreated aortic sclerosis can lead to left ventricular hypertrophy. Basically, the heart muscle thickens, and eventually, this can lead to heart failure. Common symptoms as the disease progresses are things like shortness of breath and fatigue, feeling tired all the time.
So how do we manage this condition? What can be done? What are the treatment options once it's diagnosed?
Well, Anna, the primary strategy for managing aortic sclerosis is aggressive risk factor modification. This means, tackling those underlying issues we talked about, like high cholesterol, high blood pressure, smoking, diabetes, all that stuff.
Right. So making healthy lifestyle changes?
Yes, and one of the key aspects of risk factor modification is lowering LDL cholesterol, particularly oxidized LDL, the more damaging form and often implicated in aortic valve calcification. Statins, which are a type of medication, are highly effective for this purpose. They not only reduce overall LDL levels, but also indirectly lower oxidized LDL, contributing to decreased inflammation and slower disease progression. In fact, statins have been shown to decrease the rate of calcium buildup in the aortic valve and slow calcification progression by 44 to 49%. That said, combining statin therapy with healthy lifestyle changes, such as adopting an antioxidant-rich diet, losing weight, regular exercise, and avoiding smoking, can have a profound impact, amplifying the benefits and improving long-term outcomes.
Wow, that's impressive. So, along with statins, diet and lifestyle changes can actually help slow down the progression?
Yes, absolutely. And the focus is also on addressing those shared risk factors for both coronary artery disease and aortic sclerosis. It's about, a holistic approach to managing cardiovascular health. Now, in terms of research, well, there are ongoing studies looking at the effectiveness of risk factor modification in slowing the progression of aortic sclerosis. They're also investigating the link between aortic sclerosis and endocarditis, which is an infection of the heart valves. And they're also looking into how aortic sclerosis progresses to aortic stenosis. So there's a lot of active research in this area trying to better understand and manage this condition.
Wow, Dr. Reddy, this has been incredibly insightful. I really learned a lot about aortic sclerosis today, and I'm sure our listeners did too. It's like not something you hear about every day, you know?
Well, I'm glad we got a chance to shed light to it here in our program. I really believe it's important to be aware of these conditions, even if they're not widely discussed. And I think the key takeaway here is that early detection and management are crucial. Aortic sclerosis, like we discussed, is a significant marker for coronary artery disease, and it requires intensive management of those modifiable risk factors.
Right. So, like, if you're experiencing any of the symptoms we talked about, the shortness of breath, chest pain, any of those things, it's important to see your doctor, right?
Absolutely. Early echocardiography can help detect occult coronary disease, the kind that's not yet causing obvious symptoms. So, getting checked out is always a good idea.
Okay, listeners, well, that brings us to the end of another episode of Everyday Health Stories. Thank you for joining us on this journey to better health and wellness. And a big thank you to Dr. Reddy for sharing your expertise and helping us navigate today's topic with clarity.
My pleasure.
Before we go, I just want to remind our amazing listeners that this is all for informational purposes only. Make sure to check with your doctor about any health concerns.
And if you're enjoying our conversations here on Everyday Health Stories, take a moment to hit that subscribe button. You'll get notified about new episodes and join our wonderful community of health enthusiasts.
Very well said, Dr. Reddy. See you next time, everyone. Keep staying curious about your health and keep listening to our podcast. Remember, every story has the power to transform lives.
Take care, everyone, and we'll catch you in the next episode.